Establishing a finger rest. To establish a correct finger rest in the mouth, it is important to proceed in a step-by-step manner. If your large motor skills, such as your clock position and the position of the patient, are incorrect, it is impossible for your small motor skills, such as your finger rest, to be correct. While perfecting your skills, it is helpful to practice using a periodontal typodont. It is not necessary to wear gloves while practicing on a typodont. In fact, it is helpful to work without gloves so that you can evaluate your finger placement in the grasp. Remember to keep your fingers relaxed in the grasp. If your fingers are blanched, you are holding the instrument too tightly. Step 1. Clinician's chair. The first step in establishing an effective finger rest is for you to adjust the height of your chair. You cannot work effectively in the mouth if your chair is too high. Lower the seat height so that you are able to rest the soles of your shoes on the floor. Step 2. Patient chair position. Sit alongside the patient with the arm of your dominant hand against your side and across your torso at the waist. Be careful not to raise your shoulders or your arm. The patient's open mouth should be below the point of your elbow. Step 3. Clock position. Assume the correct clock position for the treatment area. Adjust the unit light, bracket table, or other equipment so that everything is within easy reach. Step 4. Relationship of the patient to the clinician. Ask your patient to assume a chin-up or a chin-down position and to turn the head as appropriate for the treatment area. Pause for a second at this point to self-evaluate your position and your patient's position. If anything is incorrect, change it at this time. Step 5. Mirror hand. Grasp the mirror in your non-dominant hand. Establish a finger rest and position the mirror for the treatment area. Step 6. Instrument hand. Grasp the instrument with your thumb and index finger near the junction of the shank and handle. Rest your middle finger lightly on the instrument shank. Advance your ring finger and place it slightly under the middle finger. Relax your little finger in the grasp. Keep your fingers in this position as you prepare to establish a finger rest. Imagine that your fingers have been glued into position. Step 7. Finger rest. Keeping your fingers in the grasp, move your hand into the mouth with your ring finger leading the way. Establish a finger rest near the first tooth to be treated. You may need to adjust the position of your finger rest slightly. Step 8. Self-evaluation. At this point, pause to self-evaluate your grasp and finger rest. Is the tip of the ring finger on the incisal edge of an anterior tooth, or the occlusal surface, occlusofacial, or occlusolingual surface of a posterior tooth? If not, adjust your finger rest. Is your ring finger straight, acting as a support beam? If not, correct this problem. Are all your fingers in their precise position in the grasp? If not, fine-tune your grasp at this time. Establishing a correct finger rest in the mouth requires careful concentration on both large motor skills and small motor skills. This skill is easier when the clinician proceeds in a step-by-step manner each time that he or she establishes a finger rest in the mouth. The finger rest stabilizes the clinician's hand in the patient's mouth during instrumentation. For successful instrumentation, proceed in a step-by-step manner and pause briefly to self-evaluate your position, grasp, and finger rest.